things that is new, the Republicans haven't figured it out yet, but they eventually will, because they will wither away if they don't, is that people really do want to work together with this new generation. When I was at the DNC, as Jerry mentioned, the 50-state strategy, we wanted to reach out to all kinds of people that hadn't been reached out to in a long time. Because I knew from my presidential campaign there were people all over the country who wanted something different, who did have power and wanted to know that they had power. So we worked hard with evangelical Christians. Now people say, what? Democrats are going to vote, evangelical Christians are going to vote for a Democrat? And the answer is no, probably not. But we need to start the process of undemonizing ourselves after the hits we've taken for the last 30 years and becoming people in front of this group of folks. So we did a lot of polling. And one of the most interesting things we found is this. If you're under 35 years old and you're an evangelical Christian, here are the top 3 issues that you care about. 1, poverty. 2, climate change. And 3, Darfur. That sounds like a Democratic Party platform to me. Now, why can't we talk to people? We may not agree with them on some other issues, but why can't we talk? Those are their top issues, and those are in our top 10. Why can't we work together and get things done? And that's kind of the message of this young generation. And it's a great generation, I think. I mean, somebody once asked me what the faults are, and I said, I don't know what the faults of this new generation are, but I know when they have children, their kids will tell them what their faults are. That's the way it always works. So where are we going to go from here? We have an enormous amount of work. Somehow the Republicans never got the letter that said they were supposed to be bipartisan and helpful. And I'll just say right now, I believe in bipartisanship, but I do not believe that bipartisanship is more important than a good health care bill. And we have if we have to be this as partisan as we can be, I'll take 51 votes in a health care bill with a public option that people can choose and make a real difference, rather than 70 votes for a packet of mush. People are talking in the Senate. They haven't made up their mind yet. They're not ready to judge anybody yet. But this business about what I call the fake public option, the trigger mechanism. Well, if the insurance companies will behave for 3 years, then I'm sure we don't have to have a public option. Yeah, they'll behave for 3 years and a day. Then the public option will go away, and we'll be right back where we are today. But let's do it the way the state employees do. That means we pay the bill, and the insurance companies administer the fund. Message to the insurance companies. You've had 40 years to get it right. You haven't done it. It's time to let Americans choose for themselves. 45 years ago, we put Medicare with almost no votes for the Republicans. They voted for the bill in the end because they had to. But they tried everything they could to kill it, including hiring Ronald Reagan as a pitch guy. Who was, I don't know, doing GE at those times, saying, there's a great quote, I wish I had it with me because it's such a great quote. It basically says, piece by piece, America will be eaten away, and if we pass this bill, we'll look back 40 years from now and wonder where America went. Well, America's right here, Mr. President, right here, and we all have Medicare. In fact, you know what? Your wife has Medicare. And Medicare is not perfect. But I don't know how many of you saw me on C-SPAN this morning. This incredible woman called in who was quite senior. And she talked about what Medicare had done for her. She obviously had a fair amount of illnesses. And she paid into Medicare all her working life. And she was spending $4,000 a year on all her health care. That's what it cost her. Now, $4,000 a year is a lot of money. But $4,000 a year is a drop in the bucket compared to what the needs of that program are for an individual, for somebody who's 80-some-odd years old. She paid for her drug care, she paid her premium, she paid for her supplemental, and then she paid some deductibles, and she figured it cost her about $4,100 a year for full care. For somebody who's that age, that's terrific. We needed a program. You know, the poorest people in America today, shamefully, are children. But the poorest people in America before Social Security and Medicare were people over 65 years old. That's been erased, and we should be proud of that. But now it's time to give the American people the choice between whether they want a system like Medicare or whether they like their private insurance. If they like their private insurance, as the president says, let them keep it. If you like what you have, you can keep it. One of the reasons healthcare hasn't passed for all these years is because people are afraid that they'll have to be forced to choose their doctor. All this nonsense that the Republicans are spewing, thanks to Frank Luntz, since they didn't have much of a brain to think about themselves. They had to pay Frank to do it. And they're all laying out all this stuff, and it's all nonsense, but it's all carefully crafted because Frank is no dope. And it's not true. So the best, I think the president's plan is the best plan I've seen. I've been doing this for a long time. I was here in '78 as a senior in medical school, chasing around Jacob Javits and Ted Kennedy when they were trying to do it. And the president's got it right. In order not to be Harry and Louise, if I may start a new verb in this country, what you've got to do is say, if you like what you have, keep it. We're not going to change your system if you don't want to change it, but we're going to do something different. We're going to give you, the American consumer, a choice. You can choose between this new public insurance option, which is going to be like Medicare, which will follow you everywhere you go for the rest of your life, whether you have a job, whether you work for somebody that does give health insurance, whether it doesn't, and which is inexpensive. 4 cents of every dollar goes to administrative expenses, and which is pretty comprehensive. And you can choose between that, or you can keep your private insurance, or your employer-based insurance. And we'll even help you buy your employer-based insurance, as we will with Medicare if you don't have much money. What this bill does is take the choice out of the hands of insurance companies, right-wing politicians who scream and yell about nothing. And folks, I think that's the right thing to do. I think the right thing to do is to give ordinary Americans a choice. If we're going to have a single payer in this country, which we already do for people over 65, then let the American people vote with their feet. There are always people in every industrialized democracy, which has a government-run program, who choose to stay in the private sector. Let them. So what? But we ought to have the choice. We ought to have the choice. If we think a single payer is the right thing for America, then we ought to be able to be in it if we choose. And if it's single payer, we get into it, and it's no good, guess what? You can leave it and go to a different plan. That's the core of the president's plan. And I think it's a great plan. I think it's about time. We're not fighting for single payer. What we're fighting is letting the American people do what they want instead of being dictated to by an industry who has been terrible for physicians, worse for patients, and bought the Congress. And we can do better than that. So our task now is to remember that all change comes from the bottom up, and that folks respond. Is there any press here?
Maybe.
Well, I was going to tell an interesting story, but I guess I better not do that. But thank you I appreciate your identification. But let me just say, in broad general terms, there were a number of Congress people who came out against the public plan not too long ago, last week. And there was a group, which has a small headquarters in Burlington, Vermont, but has a very large presence all over the rest of the country, some of whose members may be here tonight. And those people began a grassroots campaign in the districts of these Congress people, and most of them have since backed off their statement that they oppose the public plan. Now, most of them's position is, let's take a listen. It matters. What you do matters. It makes a difference. I want to just say one thing to be really clear about this. Howard Dean did not do that. You did that. You have the power to do that. Barack Obama is not doing health insurance reform. You're doing health care reform because you put Barack Obama in the White House and gave us the opportunity. When I took over the Democratic National Committee, it wasn't because I had a lifelong ambition to be the chairman of the DNC, much wonderful as fun as I did. It was because I knew that we would never get anything done unless we had a Democratic president. I also knew that if we had a Democratic president, we would still have to have an enormous amount of grassroots support for that Democratic president.